Representative Eskamani.
Representative Eskamani.
Thank you, Mr. Speaker, and I want to give flowers to my colleagues who just spoke so powerfully in opposition before me, highlighting from their lived experiences the concerns of this legislation. And I made this point a few times already, but I want to emphasize it, that ideally, every young person in the great state of Florida has a parent that they can trust, a parent they can talk to, one they can turn to for guidance to make healthcare decisions with. But we know that that is not the reality for every family. We work on policy to make that a reality, but we're not there yet. And in cases where a young person cannot safely involve a parent or guardian, they must be able to turn to another trusted adult or provider without barriers or fear. And I referenced this a few times on the House floor, but many folks might not know that I grew up in Orlando. I'm a first-generation immigrant. My parents traveled to this country in search of freedom from Iran. They met each other working in the same donut shop, true American love story. And they were able to raise a family of one boy and two girls, me and my twin sister. And despite not having a lot of money, we had a whole lot of love. I will say that my household was fairly conservative in the context of relationships. I actually remember my mom getting very mad at my brother for having his first date because she was just fearful of the consequences of dating, if you will. And I remember witnessing this and realizing, oh, wow, like I can never date ever because of just how scary it was seeing my big brother get all this shame, if you will, for going on a date at the movies. Fast forward, my mom is diagnosed with cancer, and unfortunately, after years of fighting, she doesn't make it. I was with her at the hospital when she passed away. It was 2004. I was 13 years old, and I will never forget that night. It was the quietest night of my life, and I remember walking out of that hospital in my district where I serve today, not knowing what that next chapter would look like, but definitely feeling a sense of fear and hesitation and uncertainty. And if it wasn't for my public school teachers who gave me such immense just support and stability, I would not be where I am today. I lost my mom on a Saturday. I walked right back into school on a Monday because that was my safe place. And in the years moving forward, as you begin to grow as a teenager, I was always so scared of being in a situation that would require parental engagement because I didn't have a parent to talk to. Not only did my mom pass away, but my dad, as a household becoming from dual income to single income, had to take a job abroad, and he was not home. So for most of my life, between the ages of 13 to 18, my adult, if you will, is my big brother, who was 18, but, 18 young man. He has his own challenges to navigate. And so we had to make decisions on our own. And every day I was scared of having to face a situation and not knowing who I could turn to in the sense of legal representation because I didn't have that growing up. And so I will tell you some of the challenges that were involved in that. When my menstruation cycle started, I did not have pads or tampons. I had to use socks, paper towels. I always carried a sweater on me to cover if I had spotting. And these are the issues that many of us experienced growing up. I had to walk an hour to a Winn-Dixie to buy these items with the cash that I could find because I didn't have anyone to talk to about it. And so when I see bills like this, I understand the motivation. I understand this desire to make sure that you are inserting parents in decisions that candidly parents should be a part of, no doubt. But it's just not realistic. It's just not realistic. And when I decided to seek access to healthcare, I actually waited till I was 18 because, again, I didn't know what the law was. I didn't know what my options were. Knowing that I could have, I know I should have. But when I turned 18 in 2008, I walked into my first ever medical appointment by myself. It was a local Planned Parenthood. And I was met with just so much love and grace. And I actually remember I made an appointment for something that I didn't need. And the doctor told me I didn't need it. I came in for a pap smear. She said, "You're too young. You don't need that. You're not sexually active yet. You don't need that. And so this medical professional intervened for me to say, here's what you need and don't need. And so we have to trust doctors to play that role. We have to trust our nurses and our providers who are experts, who see everything every single day and are making these judgment calls, not based on opinion or politics, but purely based on what is the best interest for that young person, their health, their well-being, their security, and their future, which is what I like to think everyone here also centers. But this bill absolutely misses the mark, not just in the healthcare space for physical health, but absolutely in mental health. Because the notion that a young person cannot dial 988 to seek help, to seek suicide prevention, is dangerous. And this notion that being asked about suicide encourages suicide is baseless. Members, when you go into a doctor's office, they might ask you for your sexual orientation. Do you think that makes you more gay? When you're checking off a box, do you think that the information in that box makes you more of what the box says? It doesn't. And I understand this notion to legislate upon the fear of the unknown, but I will tell you that facts speak louder than fear, and facts tell us that being asked a question about your mental health and well-being does not make you less healthy. If anything, it gives us the facts so we can make decisions to ensure the health and well-being of every child in this state. And not knowing is actually more dangerous. Not knowing is more dangerous because that leads to us missing the mark and not leading with evidence, and instead legislating with fear creates an outcome that puts all of us in harm's way. And so I ask you to center on the facts, to center on policy that has historically worked. We've had this policy in the books since 1986. And this is the first time it's ever come up. It's never been legislated and litigated. Like you heard from Rep. Bartleman, it was protected because we know it is good policy. Every child deserves to be safe, healthy, and cared for. And sometimes that means trusting them to seek help when their home environment isn't supportive or safe. So let's protect that access to confidential care, not create more obstacles. Please vote down on this bill. Thank you, Mr. Speaker.
Representative Gant.